Hello, my name is Lizzie and I'm an occupational therapist at Barnes Jewish Hospital. Today, we'll be going through exercises you will have to do after your total shoulder arthroplasty surgery. We will also demonstrate how to wear your sling. Please pause the video when needed to practice each exercise individually. Completing these exercises is important in restoring motion and flexibility to your shoulder so you can return to your everyday activities. Please contact your physician before starting this exercise program. After your surgery, it is important to remember the following. Do not reach behind your back with your surgical arm for 6 weeks. Do not put weight through your surgical arm. Do not push up with your surgical arm. Complete these exercises 3 to 4 times a day, 10 to 15 repetitions each. Use your ice machine for 15 to 20 minutes after you do these exercises. Use your surgical arm to perform everyday activities such as getting dressed and bathing. Give your arm a rest if it hurts. Wear your sling in public and while you sleep to protect your shoulder. While at home during the day, you do not need to wear your sling unless your arm is tired. We will now show the hand, wrist, and forearm exercises. These exercises can be performed sitting in a chair or while laying down with your arm at your side. Hand. Close your fingers to make a tight fist and then straighten them. Wrist. Bend your wrist down towards the floor and then up towards the ceiling. Forearm. Start with your palm facing the floor. Turn your arm so that your palm faces up towards the ceiling and then back towards the floor. Remember to keep your elbow close to your body. Elbow. Bend your elbow so that your hand touches your shoulder and then straighten it back to your side. Remember to move only your elbow and not your shoulder. Keep your elbow close to your body. Remember, keep your elbow at your side at all times. Complete this exercise with 10 to 15 repetitions, 3 to 4 times a day. We will now show shoulder external rotation. While laying on your back, place your surgical arm close to your side and bend your elbows so that your fingertips are towards the ceiling. This is your starting position. Keep your elbow next to your body and move your lower arm out in a backhand motion away from your body. As your forearm moves closer to the bed, your upper arm will rotate. Stop when you have pain and return to the starting position. Remember, keep your elbow at your side at all times. Complete this exercise with 15 to 20 repetitions, 3 to 4 times a day. We will now show shoulder pulley exercises. This exercise requires the pulleys to be placed over the top of a door and an armless chair placed against the door. Sit in a chair without arms. With the pulleys at eye level, place the handle of the pulley in the hand of your surgical side first. Reach up with your non-surgical side. Hold the pulley with your hand and pull down slowly and steadily so that your surgical arm goes up. Once your surgical arm is up, pull down using your surgical side only. Remember, always keep your palms facing each other. Only pull down with your surgical side. Do not lift up. Complete this exercise with 10 to 15 repetitions, 3 to 4 times a day.